join us every Wednesday. Put up with our shenanigans so that he can help us health-wise. He's a cardiologist with St. Louis University Care and SSM Health. Good morning, Dr. Michael Lim.
Good morning.
Let's talk Zika virus. How worried, I know the CDC came out this week and talked about it, and there's a lot of talk about it. You hear the Olympics, but how worried should we be about Zika virus?
Well, I think there's two definitive schools of thought that are exactly opposed. So on the one hand, we don't know what we need to worry about. We don't have definitive long-term effects of what Zika does. We know that it affects the developing fetus inside of a pregnant woman, and the brains become much smaller and are underdeveloped. That's very scary. But then, on the other hand, the lack of what we know scares us all. What are the possibilities, the ramifications? We just heard Rory McIlroy pull out of the Olympics because of these scares. And I think so. It's a lack of knowledge that scares us.
Once the baby's born, and we've seen the pictures, is there permanent damage done to those children?
Yeah, those brains, as far as we understand, are underdeveloped and don't really have the capability of catching up.
Yeah.
And so this is not necessarily a good thing or something that we can recover from.
We have a couple of cases here in America from people traveling down and coming back. Are we preparing anything in the medical community for this?
So the biggest thing, and this is actually one of our specialties at SLU, is one of the best treatments that have been developed in our lifetime is vaccines. And so the government has put forward major efforts to try to develop a vaccine to prevent the development of this virus. And that is underway. Now, we just learned about this, and this is all brand new, so we can't just flip a switch and say, okay, we're going to have it in a couple months. This takes a little bit of time. But that's one of the efforts underway to try to minimize this concept.
You can't do it in a week, but unlike polio, where polio was the first of its kind, we know the formula of how to come up with a vaccine. So it might not take 20 years, but it will take a little bit of time.
The hope would be that it doesn't take 20 years, but you have to come up with the vaccine. Then you have to test it and make sure, first of all, that it's safe, that it doesn't cause anything harmful in itself. I remember the polio virus was actually a live virus, so we were actually, when that first came out, inoculating people with polio. That wasn't necessarily something that people gravitated to and stood in line and said, sign me up.
Right.
But we have to figure out that it's safe, and then we have to figure out whether it's effective.
Yeah.
There have been cases in Missouri already.
There have.
Yeah. Once you are treated for Zika, are you ever fully cured? Do we know?
Well, I don't think we have a treatment for Zika yet. So I think everything has been put into two things. One, avoidance. And so understanding that the populated, or the areas south, Puerto Rico, Cuba we can travel to now, or South America where the Olympics are, these places are more endemic with Zika. And if there's any concern from a standpoint of if you're childbearing age and that type of thing, the CDC is recommending not to travel there.
Yeah.
Other prevention in terms of what we can do here, bug spray. And wear it, even though it might smell or it might be uncomfortable, and try to avoid being bit by mosquitoes.
Senator Blunt has said that it's coming, and whether it shows up in Florida, Texas, but eventually it will be here in Missouri, much like West Nile. It's coming.
Yeah, I think that the travel patterns of bugs and these types of things are very rapid these days.
Yeah. All right, Dr. Michael Lim with us. Also, there's a good study. Let's end on a good note. The health of children is improving in this country.
Yeah, so good news. And there's a lot of stories out there in terms of, and the other part of this study was, well, maybe the average lifespan of Americans is going down for the first time in a long time, and so we're not living as long. That's kind of scary, and that relates to smoking hasn't necessarily gone down, high blood pressure hasn't been treated as well, obesity, inactivity, all kinds of things. But the good news part of this study is that when they looked at children, they saw an uptick, and they saw that their health was improved. And so hopefully there's room for a brighter future.
I've heard people say that our mortality rate is not as high as others because we're so advanced, we can keep people alive who wouldn't normally be alive. And so they might die, they might live longer, which then is a drag on our life expectancy?
Well, this is this gets into the expense and how much we put into healthcare in this country. It is true that we spend an awful lot of money in the later years of life, and we throw a lot of technology at patients to try to keep them alive, potentially only for the short term. The argument has always been that preventative efforts, so that if we could avoid people ever coming down with those types of afflictions, would be way better spent. They're just a lot harder to do.
Yeah. Dr. Michael Lim, great stuff. As always, thanks for coming in. Nice bow tie, by the way.
I do like the bow tie.
A very, very nice bow tie. I don't see any Michigan colors on that bow tie.
No Michigan colors, but we got to keep it cool on a hot day. So.
Dr. Michael Lim, cardiologist with St. Louis University Hospital. Thanks for coming in, Doc.
Thank you.